is Little Kansas Kitty, and I welcome you back to my weight loss surgery channel. I had the RNY gastric bypass surgery a year and a half ago, so that was on June 25th, 2018. I started off my high weight at 238 pounds. I'm 5'6", I'm 39 years old, I lost 100 pounds. And then I created a maintenance range for myself and have been there since 32 weeks post-op RNY gastric bypass. I stayed within 138 to 145. With that 100-pound weight loss, I did experience loose skin issues, and primarily in my booty region. And so if you've been following along, you know I've been dreaming of a new butt for Christmas. All I wanted was 2 new cheeks, and here I am 1 week post-op to plastics. So last week, exactly a week ago, I underwent plastic surgery, and I had all of the excess skin removed from my back, from my lower back. I had lipo done, and I had any and every little ounce or cc of fat that they could find transferred into my bum region. I also did go ahead and get the silicone implants. So surgery was as expected. If you've gone through surgery, you kind of know the ins and outs of surgery. You know, they take you back and you meet with the nurse and you get your labs done again in terms of, are you pregnant, are you not? You get your pregnancy test taken. You meet with the anesthesiologist, you go over all of your vitals and all of your meds that you may be allergic to again. Then the doctor comes in, the surgeon comes in prior to taking you back to surgery. So the surgeon did go ahead and mark me. And underneath my gown, I asked the nurse if I could go ahead and keep some thong panties on, because I wanted to use those panties, that panty line, as my incision mark. And so the doctor came in, marked me up, and basically created the cut. So I do have a scar going down right where the panty line runs, and that is where the skin removal process was done. I did go ahead and tell him that I wanted to go with the subfascial placement, and he said that he thought that was a really good decision for me in terms of my running. Surgery went great. It was about 2.5 hours long, and the first day was a huge success. My sister took me to surgery. She brought me back home. She is a nurse, and so she really nursed me into that first evening in terms of getting me into bed, and I was moving along really, really well. The ride home was easy peasy. I think I slept through most of it, and she made sure that I was on my meds. And I think coming home, I still had so much anesthesiology in me, and so I was feeling fine. I was feeling fine. I went ahead and bid her farewell and sent her home to her family at about 7 o'clock that night, and my surgery was early. It was early that morning at 9:40. And I said, go home to your family. I'm good. I know what signs to look for in terms of an infection. If I'm going to have an infection, it should happen soon. I should start to get the chills and the fever. And I know that you, my doctor, everyone is just a phone call away. And as a single parent and not really having anybody at home, it was just me. And so I was okay with that. I knew I had my pain meds, I had everything by my bedside that I needed, and I already knew that I could make it up and down the stairs. By day 2 and 3, things began to get rough. And let me just tell you, my torso area was very swollen. My thighs were really, really swollen, and I was having a lot of fluid retention, and I was beginning to feel uncomfortable. Even with the pain medication, it was just, I could constantly feel the implants. I could constantly feel the pressure. And I could feel this burning sensation towards the bottom of my butt where the implants ended. And I even called my doctor's office, and they said, it's expected, it's okay. This is part of the healing process. I was like, okay. So mentally, I was feeling really, really down most of last week, and I was actually even having buyer's remorse. I was like, what the hell did I do to myself? I can just feel this like constant in me. I'm not sure I should have gone through this. I know I rushed into it and I was not feeling good about my decision. I was just trying to watch the clock and the moments tick away and just wishing the days to speed up and to go faster and to let this healing really kick in. I was so uncomfortable, and during recovery from butt implants, from butt augmentation, you are not to sit for several weeks. And so trying to find a comfortable position where right now I'm kind of kneeling down on a seat, like you can't sit. You're going to kneel. You're going to be laying flat on your tummy. The nice thing is you can lay on your sides, and that is where I did find some comfort. But other than kneeling, walking and standing is actually probably some of the most comfortable spots, because everywhere else I just feel constant pressure. And so I was having that buyer's remorse. I was just feeling constant pain, constant discomfort. Sleep was awful. I was highly medicated on a lot of pain meds, and just, I mean, in no way productive in any way last week. Sleep time, awake every single hour or two, just so dang uncomfortable, just not able to find that comfortable position, and tossing from side to side to tummy, to side to side to tummy every hour or two, and making sure I'm up on my pain meds, and sleeping 12, 13 hours a night doing this. It's painful. It's uncomfortable. It truly is. Seeing the scale begin to creep up a little bit was scary for me. I was pretty diligent in terms of protein shakes and just trying to keep it easy with meals at the beginning of the week. Then I started to have a little bit more comfort food just to make me feel a little better. And knowing that my pounds were up, they were up from my maintenance range of 138 to 145 was scary to me mentally. But then I had to remember that the implants themselves, there's weight to them. And also, if I didn't explain it before, the implants are silicone. They are solid. They're not like breast implants that are fluid sacs. And the best way that I can kind of compare what a butt implant is I think of kind of my gel wrist pad on my mouse at the computer, or my gel wrist pad at the keyboard. You know how it's kind of squishy, but it's solid and firm, but it's very flexible? That's kind of actually the material that a butt implant is made out of. And thinking about the weight of those reminds you, I did go with the biggest that my surgeon's office offered, and I am probably adding almost 2 pounds extra by just the implants themselves. And so I had to think through that and think, okay, you're not running 60 miles a week right now, and mentally this is killing you because you're so used to that fresh air, so you're so used to burning so many calories, you're so used to your social hour. And I had to really dig deep and bury myself out of this pity party and say, come on girl, you can do this. You've made it through several surgeries before. You're going to heal. You're going to make it through this. All pain heals with time, right? All wounds heal with time, and you can make it through this too. You wanted this badly, and you're gonna make it. I had my surgery on a Monday, and by that Friday I had my first follow-up appointment with my surgeon's office, and I learned that in terms of the lipo that was done, I only had about 150 cc's removed, not much at all. And part of that is actually water, and so only 100 what he was able to salvage and put back into my bum. And the area that they were really focusing on was kind of the sides, because naturally our bums, as we age, they kind of dip in here, and he wanted to create a little bit more of that fullness and fill that little pocket area. And so I had about 100 cc's, I guess about 50 on each side, placed in there. That morning, kind of looking at my butt, I was happy, but the perfectionist in me, and thinking how much money I did really spend, I was like, I'm not like 100% thrilled with the shape. So where the implants are, whoo, it is smooth. It is smooth as glass, smooth as a peach, and it's beautiful up high up here. Then as you get a little lower, I still have some excess skin there. And it kind of sucks, but I didn't have a perfect butt before. I'm not going to have a perfect butt. I'm not 20 years old. I'm going to be 40 years old, okay? So we're dealing with what I have, and plastics does not change your body completely. It enhances what you do have. And so I was a little bummed because I've got some areas down below that aren't exactly, it has a little bit of flatness down there where I wanted it to be really round and perky, and it's not. And so I have to kind of accept that. But also talking to my surgeon, he said that we are going to let things settle. Let's hold off for a minute. It's only been like 5 days. Let's let things settle, drop, fluff is what the term is, and kind of look at it in March, and if we need to do some revisions, then we'll do those in March. I was then reminded of my tummy tuck, my mommy makeover that I had 8 years ago, and I had a revision surgery with that too. Revisions are very, very common. I had an area in the back kind of where the my tummy tuck incisions had gone back then, and those revisions are typically done in office, not at the surgical center. They can take care of it there, and you are numbed, or but you're not completely put under usually for those. And so he said, let's look at it in March. If we need to, we will transfer some fat, move some things around, and plump up those little flat areas. But he said, give it a little time. Just be patient, give it a little time. The scar itself in the V, you know, my goodness, like what he was able to remove excess skin wise is incredible. I still am, when I'm trying to put on clothes, I am so used to draping like a sweater on, having everything kind of showing in the front and smooth, but always like trying to hide that, or maybe tucking my shirt in the back but letting it hang out in the back. I've been very strategic over the years, and I'm so in the habit of covering that area where I've had excess skin, and it's gone. Like, my back is smooth. I can't get over it. I love it. I love it. I love it. And I love my body now in pants and jeans and anything. Like, it looks amazing from where I was. I was a flat little pancake before, and now I have a shape. Like, I have that S shape going on, and it looks youthful, and it looks very proportionate to my body. I'm really, really pleased with the size, and I think it's the best that it could be, and I am very, very happy with the outcome and the look, especially in clothes. Where the incisions are, and you know, it's not pretty. It's very scary looking right now, and it looks like kind of like a Raggedy Ann like stitching, or like the Day of the Dead like scars. It's like, it's scary looking, but it's actually not even any stitching, because what they do is same as a tummy tuck, is they use surgical glue, and so they're basically just gluing your skin together, and what you see that looks scary is actually just some of the blood kind of seeping through, and then there's tape over that. And I have an appointment for this coming Friday for them to remove the tape, and then that's when I'll begin scar therapy. And focusing on some of the positives, I have complete sensation. I have no loss of sensation or feeling, which is a great thing, because with tummy tuck there was so much like nerve damage at the beginning where the nerves had to kind of wake up again, and I had to, you know, begin to feel again. I can feel everything. I can feel all along myself, and I've got complete full feeling. Also, just reminding myself to look at the positive, that each day is going to get better. Damn, I look good in my clothes right now. I'm wearing my same clothes that I wore before, but they're just looking so much fuller and so much better, and every day is going to get better. I did get some love-ins in, and I know this is TMI, and you're not supposed to have sex for probably several weeks, but you can be pretty strategic and creative about it and get your love-ins in. some of the positions that I need to get in, just like kneeling, laying on my tummy, going from side to side, standing, all of that is becoming second nature a week later now, and I'm just getting used to it. I'm still gonna have to do this for several weeks out. Fortunately, in terms of work, I did take a week of vacation, and then my office closed for almost 2 weeks, so I have 3 weeks off to recover. Today marks exactly 1 week post-op to my procedure, and this was the first day that I decided to go ahead and just take Tylenol. At my follow-up appointment, I was like, I need more pain meds, like definitely, and I probably am going to take some of the pain meds tonight to help myself sleep, but for the full day today, I only took Tylenol, and I was really proud of that. And it's the moment that you go off the narcotics, you are free to drive. Crazy, right? So I had that booty pillow that I showed you in my last video, and I did go ahead and drive and run some errands today, and I just felt normal. Like, I just felt free and independent and normal, and what that did for my brain and for my mind and for myself, like for my well-being, was amazing. My doctor did tell me that I can begin walking, like walking, neighborhood walking and stuff this coming weekend. So like 2 weeks post-op, I am probably gonna push that up. And granted, I'm not your average patient. I, prior to surgery, was running 60 miles per week. I'm a marathon runner, and I am feeling like I'm able to start doing some walking again. Just running my errands today really reassured me that, yeah, I can get out there, even if it's just for like 30 minutes or so. I know how healing and how wonderful that fresh air is going to feel in my lungs. So what are some of the reactions that I'm getting going into it or post-op? I wanted to share that because everyone is going to have their own opinion of it. One of my friends asked me and said, what is your daughter going to think about this? Like, you doing these things to your body, is she going to think that she needs to change things about herself? And that's a hard question to ask someone, and it's something difficult to kind of think about too. I want my daughter to love and accept herself for who she is inside out and out, and I don't want her to think that she has to change anything to be beautiful, because she is such a beautiful being. But at the same time, she does know about me having lost this weight. She knows that Mama's booty was flabby, and she and I would get ready in the mornings together, and she just made a game out of it. And she was always like messing with me and grabbing my butt and pretending like it's like Play-Doh, and like it's just giggling and, you know, moving around. She knows that that is not normal compared to what she has, and so I had explained to her that, you know, Mama lost a lot of weight, and that is what happened to my body after I lost a lot of weight. And she's like, but I love your booty, Mama, I love it. And she like jiggled around, and I was like, well, thank you, baby, but Mama doesn't. And so I have to look at, she is such a sweet girl, and I hear that over and over and over again from outsiders and from people, what a sweet girl she is. And I think that is something as a mother that we need to also focus on, that beauty is not just outside. You know, it's not the outside, it's really what's within, and how you treat people and love people, and what's inside is what really matters. But if she becomes an adult later on and there is something that she really wants to change, medicine and technology is incredible. It's amazing. It's so advanced, and we have the ability to do that. And I will support her. If she is an adult down the road, or maybe she's had children and her body has changed and she really wants to change something and she wants to get plastics, I'm going to support her. Heck yeah, I'm going to support her through whatever she decides that she wants to do as a woman, as a female, because I think we have the power to do that, to make those choices. My son, on the other hand, teenager, he's always like, Mom, when you get that booty fixed? Because it is flat, like it looks bad. So he's already seen me after, and he's like, yep, looks good, looks good. In terms of my man friend, the weekend before going into surgery, he was like, hey, you never did tell me, what size did you end up like, going with? Like, what did you end up deciding on size implants? And I was like, I went with the biggest. I was like, go big or go home. And he was like, you did what? Like, he was kind of freaking out about it for a minute. And I was like, no, 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 no. My surgeon's very conservative and very moderate. And I have a really good feeling about this size, that this size is going to be perfect for my body. My sister, the nurse, she was like, can you just be happy with what you have? But then at the same time, when she saw the after, she was like, you look good. You look good. It looks good. My running friends are very supportive. They've had surgeries to enhance themselves or to help in different areas, and we're very supportive in whatever choices we make and how we decide to spend our own money. The weight loss surgery community has been so supportive. You guys, oh my gosh. Like, this is the best community ever. So positive, so encouraging, checking in, just feeling the love. My man friend, the first time that he did come visit, he was out of town when I had surgery. He came back from out of town and he was like, dang, you got a booty. And I was like, yep. And I said, I cannot wait to wear jeans again. And he's like, He said, you need to be wearing yoga pants for the rest of your life. So what's next? I am looking forward to trying to eat a little bit better. I did great at the beginning. I am doing really good with my protein and my water. I need to eat a little better. Easier said than done around the holidays. I'm also looking forward to walking. I'm looking forward to this healing to continue, to this pressure to go away, and to the point where one day I'm going to be like, I don't feel anything. Like, it just feels natural. I'm looking forward to wearing all of my old clothes again and feeling youthful and beautiful. Thank you from the bottom of my heart for your support and your love throughout this journey, and I'm wishing you all the best throughout your journeys, and some of you that are just beginning to decide to make some big life-changing decisions into 2020. From my family to yours, happy holidays, and may the magic of Christmas be with you.